Critical thinking is often described as a skill nurses should have, but rarely is it explained in a way that feels practical. Many students hear the term repeatedly without understanding what it actually looks like during a real shift. In nursing, critical thinking is not about being clever. It is about making safe decisions when information is incomplete. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. A common misunderstanding is that critical thinking means questioning everything or overanalyzing situations. In reality, it means knowing what matters most at any given moment and focusing attention there. Critical thinking helps nurses avoid being distracted by less important details when patient safety is at risk. Think of critical thinking like navigating through traffic. You cannot focus on every car at once. You watch speed, distance, and movement patterns to avoid danger. Nursing decisions work the same way. Nurses identify risks, anticipate problems, and adjust actions as situations evolve. At the bedside, critical thinking begins with assessment. Nurses observe changes, compare findings to baselines, and recognize patterns. They ask why a change might be happening and what could happen next if no action is taken. Critical thinking also involves prioritization. When multiple tasks compete for attention, nurses decide what must be done immediately and what can wait. Airway, breathing, circulation, and safety guide these choices. This process protects patients during busy and unpredictable shifts. Communication is a key part of critical thinking. Nurses clearly report concerns, question unclear orders, and advocate for patients when something does not seem right. Speaking up is not confrontation. It is professional responsibility. The nclex tests critical thinking by presenting scenarios with multiple possible actions. The correct answer is rarely the most complicated option. It is usually the safest and most logical response based on the information provided. In real nursing practice, critical thinking continues after action is taken. Nurses reassess patients, evaluate responses, and adjust care accordingly. This continuous loop of observe, act, and reassess prevents small problems from becoming major ones. Experience strengthens critical thinking, but it begins with a structured approach. Nurses develop confidence by reflecting on decisions, learning from outcomes, and staying open to feedback. Critical thinking grows through practice, not perfection. Strong critical thinkers do not rely on routine alone. They recognize when a situation no longer fits the routine and adjust accordingly. This adaptability defines safe nursing practice. Now that you understand how critical thinking guides nursing decisions in complex situations, the next step is exploring how nurses prepare for specialized roles and future career paths. That broader perspective helps turn competence into confidence, and that's exactly where we'll go next here at the Learning Studio.